Okay, hi everyone. So we're going to talk about head and neck muscles and just the very basics in terms of this lecture. All right, so here's the OpenStax version, and if you compare it to the old Martini book, now it labels some of it, but not all the muscles, because you can see like what only labels like these muscles right here, maybe six of them, but you have way more than six muscles on your face and skull and neck. All right, so I wish the OpenStax one had this version right here with the Martini book. But what you can see is that there's a lot of muscles that are involved are on your face, and these are very important in creating all the facial expressions and all the different ways you can move your face and cause those expressions. Now, here's an example when you're first starting out. Like when I first was like, again, we have what over 600, possibly 800, depending on who you ask, like muscles. And the way I like, especially when there's a lot of information at start, I like to find systems and common patterns first, and then sometimes there's like different examples that don't quite fit those patterns. But by that is just okay. I try to go for the big roles first, and then try to go to the details. So one of the ways I was taught to study this was classifying these muscles because why? Well, things that action means like how a muscle moves, and then heads we'll talk about in another lecture. And there's different ways of describing a muscle, and some of the muscles they have very long names, but these very long names can tell you a lot of information on what they look like, what they do, where they are. So we'll apply this to head and neck muscles. So here are some examples I'm pointing out right here. So here are the orbicularis oculi and oculo. If you remember things like, what's a monocle? Well, it's just one lens. If you have binoculars, you have two lenses, and oculo or oculi means eye. So and then we have the nasalis, and nasal means nose, and that is a muscle on your nose right here. Then you have the levator labii superioris, and labia means lips. And so what it's going to do is attaches to, as you can see, the lips over here, or I should say, around the lips. And then you have the orbicularis oris. So orbicularis, but instead of oculo, it's oris. So like oral means mouth. So here we have two muscles that move the mouth. And mentalis is cut in this one, but if you remember your anatomical landmarks, what is mental? So, and we're talking about surface landmarks. Mental doesn't refer to this, it refers to your chin. So this is a muscle right here on the chin. So this is why it's very important and why I really emphasize learning those landmarks, because this is where it pays off. A lot of these use the landmarks in their name. And if we use this chart right here, so orbicularis oculi, oculi meaning eye, nasalis meaning nose, and then we have the levator labii superioris and the orbicularis oris. So the labii support, or actually rewind a bit, the levator labii superioris and attaches to the lips, orbicularis oris, and the levator anguli oris. These also move the mouth, the oral part, and mentalis, that is located at the chin. So landmarks are very useful, and if you need a refresher, I suggest going back to the first chapter and getting that list. All right, so there's more muscles. And here we have the occipital frontalis and the frontal belly. So no, it's actually this entire part right here. And then we have the occipital frontalis, the occipital belly. So the frontal belly would be in the front, and the occipital belly is closer to the occipital bone. And if you're using the anatomy coloring book, the OG first one, then they list it as separate muscles as the frontalis and occipitalis. And sometimes in other books, they call it the epicranius. They all refer to the same general structure. But I've seen this occipital frontalis favored more than the other two names. Then we have the nasalis, that same one on the nose. And then the temporalis. So where is your temporal bones and where is your temples? It's on the side over here. And then the zygomaticus majoris and the zygomaticus minor. And where do they attach to? They attach to this bone. And what are your cheekbones? These are your zygomatic bones. And then you have the sternocleidomastoid, and we'll get to that real soon. So what is the sternocleidomastoid? Well, let's break it down. And this is one of my favorite. Sometimes it's also called SCM because this is a long name, but this is one of my favorite muscles because it's a long name, but tells you exactly where it attaches to. Now here's another way of looking at it. So it's a neck muscle, and sternum. So sternum right here, that bone right in the center of your chest that connects to your front rib cage. So the sternum cleidomastoid, part of it attaches to the sternum. And this is where it's a little tricky. So there's another term for clavicle called cleido. So what we have is another part of this SCM, the sternocleidomastoid, attaching to the clavicle. Now, what does mastoid refer to? So the temporal bone has this part called the mastoid process. It's hard to see here, but if you take if you go to the back of your ear and feel the back of the ear, you might feel this round structure over here, and that is your mastoid process. So the sternocleidomastoid attaches to this back part of the temporal bone that's located right behind your ear. So what happens when you put them all together? You get the sternocleidomastoid. It literally tells you sternum, clavicle, connecting to the mastoid process in the back. And you have a pair of them. And if you see someone like really have prominent sternocleidomastoid muscles, they have kind of like this V shape because they are kind of like located like not only going from here all the way toward the sternum and the clavicle over there. And cleidocranial dysplasia, I know, was it Stranger Things is ending, but if you remember the very first episodes, like, yeah, he's a full-grown adult now, and I think he has implants now, but was it Gaten? I forgot his last name, Matarazzo or something similar, but yeah, him. But what did he do in one of the very first episodes? He said he has cleidocranial dysplasia, and one of the things he did is like he put things that when you have cleidocranial dysplasia, well, it affects the teeth, but also affects the collarbone over here, the clavicles. So he was able to do this. I forgot which episode, but he's able to kind of put his shoulder blades forward and shoulder forward, way forward than most of us can because of the lack, or I should say, not properly formed clavicle. So what is dysplasia? It's a kind of advanced term, but if you're going to nursing or medicine, it's very useful. So dysplasia refers to abnormal growth or structure or some development or something didn't develop normally. So this is why people who have this condition, they don't have so cranial refers to the cranium. So in this case, he didn't have this part of the cranium, or actually that's the facial bones, but still it's like involved like some of the skull bones. And the cleido, that refers to clavicles. So the clavicles didn't form properly. That's why they can do these movements most of us can't. All right, so what's my main point here? So the bones. Here we have occipital frontalis. It's the frontal bone in the front, occipital bone in the back, and it spans that. Temporalis is going to be on the sides of your head. Temporal parietalis, we didn't cover that, but it's actually cut in those images, but just know that, hey, this is also named after bone. Nasalis, not only is it your landmark of your nose, but you also have a nasal bone. You have zygomaticus, and actually a pair of them, or actually two pairs, I should say. But on one side, you'll have a zygomaticus major and a zygomaticus minor. And what makes it major versus minor is like the bigger one, or bigger on average, is the major. The one that's smaller on average is the minor. And then you have sternocleidomastoid, one of my favorite muscles. That's a SCM. Sternum, clavicle, and the mastoid process in the temporal bone. Take a step further. So here we have the levator anguli oris. So where is this and what does it do? Well, again, oral, in terms of anatomical landmark, the term for mouth is oral. So this is going to be the orbicularis oris, but this is a different muscle, but it helps to move the mouth. Now, the levator anguli oris is highlighted here in yellow. And what does it do? It pulls upwards. So the elevation is going to pull upwards like an elevator goes up. And what it does is it's going to pull things like this. So it's going to pull the angles of your mouth up. So it's one of the ones that help in upturning the corners of your mouth and helping with smiling. Now, on the other side, you have something here, a different muscle. And what it's going to do is going to pull the angles of your mouth down. So it helps with frowning. And this is called it's still called anguli oris because it's going to the angles of your mouth. But instead of levator, it's depressor. So it's actually going the opposite direction. So this is where that rule comes in handy. So like that, if there's muscle that does an action, there are at least one muscle that does the opposite. So sometimes if there's one, like if there's a levator, there's probably a depressor somewhere. And this applies to, I would say, most of the muscles. There are some exceptions, but this is a good general rule for a lot of these pairs of muscles that oppose each other. Now muscles, so labia is the landmark term for lips. And so there's levator labii superioris. And we have this muscle right here. That's the levator labii superioris. So what is it going to do? well, elevator goes up, and it's going to lift the lips, and its superioris refers to where it's located compared to the lips, and it's above the lips, therefore it's superior to the lips. So it's telling you not only what it moves with the labii, it's telling you what it does. It's going to lift it up, and where is it located? It's above the lips. And that's why I love, even though they might have long names, they sometimes tell you so much information. Now back to the opposite roles. Here's another muscle, and here it's going toward the lips as well. So it'll have labii, but it's below the lips. So, and it pulls down on the lips. And this would be the depressor labii inferioris. So that's the opposite role yet, or I should opposite tips role in general, like helping again. So, okay, so now let's talk about muscles that help with chewing. So there are mastication. So mastication is just a fancy term for chewing, and anatomists love to, and physiologists love to come up more technical terms for everyday things, and that's the example. So masseter, or I've heard masseter or masseter, and it comes from this Greek word massethai. Sorry if I'm mispronouncing that, but it literally means chewing muscle. And some of these muscles, they don't quite tell you like about their direction or where they are. They tell you more about what they do. And there's also something called I've heard buccinator or buccinator, but either way, it comes from this Latin term buccinare, which means to blow a trumpet. So this kind of helps to kind of like puff out and suck in things like when you're blowing a trumpet, supposedly. All right, so then there's also another muscle called the risorius, and I don't think I quite see this in the OpenStax version, but I'm showing you that it would be here on the side and of the angles of your mouth. So this is over here. And it's kind of funny that the risorius, so massethai means chew, and then masseter or masseter, chewing muscle, buccinator, blow a trumpet. Now risorius is interesting because I don't think there's a real equivalent in English, or there could be, but I don't know it. But there's a Latin rideo, which means laugh, and if you know Portuguese, like rir means laugh, and then actually there's an extra I there, but ridere means laugh in Italian, and then rir means laugh in Spanish, and rir means laugh in French. So these all come from Latin, and they all mean laugh. So it's a laughing muscle, but think of it, when it's going to the side right here, and what happens when you pull it? It's more like, and do you really laugh like that? So it's kind of a stupid name, I think, but I like to call it the student smile, because I get this smile a lot, like when you're smiling, but it's not quite like a upturned angle smile. That's what the risorius does. It's kind of, I like to think of it as like the fake smile muscle more than the laughing muscle. But either way, this is telling you like, okay, some of these muscles, they're named after what they're supposedly doing when you contract them. And back to mastication. So mastication actually means to chew, and there's more than the masseter or masseter muscle. You also have these other muscles. So mastication is just a technical term for chewing. Now you have the masseter, and the way I like to memorize first learning the masseter, I think when you chew, and you can actually feel it when you chew. You feel right here. You can feel this very thick muscle that's contracting. And that is your masseter. And I think like when you move that and move your jaw, you're mashing up your food. So I like to mispronounce it in my head, or even further saying it's the masseter. The masseter helps to mash your food. Then there's temporalis. Now chew again. And you can like feel the temples, and you might be able to feel one of your muscles chewing when you are moving, when you chew. And then that is your temporalis moving. So that also helps with chewing and moving your jaw. And then you have the lateral and your medial pterygoid. So they're a pair of muscles, and these attach to not only your jaw, but the sphenoid bone on the inner part of your skull. It's kind of hard to see there, but there are only 4 muscles types that help with mastication. You have 4 pairs. You have your masseter, your temporalis, and the lateral and medial pterygoids on your left and right side of your skull. And there are muscles that move the tongue. So tongue, like there's the gloss or glot is a very useful Greek root word meaning tongue, or sometimes language. Like if you have a glossary, that's like a list of words, and then we have a glossolalia. So this is like the term they use, a fancy term for like some religions, they call it, or they say speaking in tongues. That's what it's referring to. And a polyglot, this is like some of those people who can speak multiple languages. So it's like, but to speak a language, you need to use your tongue. And gloss over is like someone who's like very good at speaking and they don't really cut, they kind of like waffle and they don't really talk about details, kind of like some people you might know. So that is like referring to speech and the tongue. So notice that a lot of these muscles, like, hey, we have the styloglossus, the palatoglossus. So if you have the palate, and aponeurosis is just like a broad sheet of connective tissue. So it's like, rather than like a coming to a point like a tendon, it's more like a broad tendon. But either way, the palatine aponeurosis in the tongue, so attaches the palate to the tongue, and you have the palatoglossus. Styloglossus, on the temporal bone, you have that pointy process called the styloid process. Attach that to the tongue, then you get the styloglossus. Genioglossus, this is where it's like introduce a new term. Genio is a term for the for the chin. So this is going to go from the chin right here and help anchor the tongue over here. And the hyoglossus, this refers to the hyoid bone we see here and the tongue. So any muscle that has gloss in it is going to attach and help with moving the tongue. That's why you can move your tongue in so many different ways. You have all these muscles that help along with that. Now here's the pharynx. So the pharynx is kind of like this up back of your mouth right here and your throat. And the palatal muscles, so tensor, levator, palatini, and levator. So they are, notice that they're up here toward the roof of your mouth, their palate. Now, in terms of like identifying them, just know like, okay, it's kind of, they tell you what, not only what they do, like tensor is going to like make it tighter, levator is going to lift it up, and they're going to move that soft palate you can feel in the back. You have the bony palate toward the front, the harder part, and the softer part in the back. And that. Then you have the pharyngeal constrictors. So these are muscles that kind of wrap around the pharynx and the throat part. So what they do is when they constrict, they are going to help, like a boa constrictor is a snake, is that's going to like squeeze. That's what they do. So we have this pharynx, and when you constrict that, this helps to move food that that you eat and chew up down into hopefully the right pipe, the esophagus, where you can reach your stomach and the rest of your digestive system. And then, okay, so throw back to the skeleton. This is showing the axial skeleton, but this isn't the entire axial skeleton because some bones are missing. And so some of the bones that are missing are the auditory ossicles in your ear. But one thing that's very important that's missing is the hyoid. So the hyoid, again, is very special because it does not directly form a joint with any other bone. But is it just floating like in this picture right here? No, it's actually, so the hyoglossus was helping anchor the hyoid bone to the tongue over here, but there's so many more muscles that attach to that, and that's why it has all these horns right here, because when you have something that pokes out, sometimes if it doesn't fit into something else, it's often where something grabs onto it. And the hyoid, a lot of muscles grab onto it, and also ligaments. But what we have here is like, okay, the styloglossus or is going to be toward, or actually that's a different bone or muscle. But you have the hyoid bone again here, but notice that is anchored and held in, or actually anchors a lot of muscles. So even though it doesn't directly form a joint, this is how it stays in place. Now there's the mylohyoid, the geniohyoid, and these are all these muscles that have the hyoid in their name. Genio means chin. Mylo is this is a very specific term, but it's referring to molar. So it's like kind of going from the hyoid to the back of your teeth, or the general area. And then you have things like the thyrohyoid. You have the thyroid gland over here. The omo is a rare term, or I should say, yet another term for the shoulder. Less intuitive, but it's going from the hyoid to the shoulder. And then you have the sternohyoid. That's going from the hyoid to the sternum. So this is where this becomes very useful, and why the hyoid is so important. It's not, even though it doesn't directly articulate with another bone, it helps with, it anchors so many of the muscles. So you have geniohyoid, all of these have hyoid in the name, and it sounds similar. There's a sternothyroid, but that's not referring to the hyoid bone. That's referring to the thyroid, or general area of the thyroid gland. And let's see, so let's round this off. So we talked about orbicularis oculi and orbicularis oris. So ocular referring to eye, oris referring to mouth, but orbicularis referring to kind of like their shape and also how they are arranged around these structures. So they're kind of orbiting and circling around the respectively the ocular region, the eye, and the oral region, the mouth, respectively. And let's talk about some muscles over here. So here we have, let's talk about the trapezius over here. So the trapezius muscle is named because supposedly it looks like a trapezoid. But if you look at the overall muscle, like if you look for, it's actually this big kite-shaped muscle. Now the trapezoid is supposed to be like kind of parallel on two sides, but I don't think they're quite parallel on this side. It's more, I would, if I had to rename it, I would call it like the kite-shaped muscle or something like that. But what we have is like, it's more like this. You get this broad muscle in the back, not the broadest, but is part of a lot of the muscles, or it is one of the major muscles in your back. Now, maybe this part could be considered trapezoid, but you have the lower trapezius, and that's not a trapezoid. Or maybe if someone's like super buff and has like these huge traps, maybe from the front, or in this case the back, it might look like a trapezoid. But again, your trapezius is more than that. It has this lower trapezius that isn't quite trapezoid shaped. But that's supposedly what's named after. And then there's the deltoid muscles that wrap around your shoulders. So they're named that because if you kind of look from the side, they're kind of like the Greek letter delta. The uppercase delta in Greek is a triangle. So the Greek alphabet right there. So that's why it's called the deltoid, because it's kind of looks like a triangular muscle. So sometimes they're named after shape, like the trapdoors. Sometimes they're not quite accurate, but they do. This is how they were named. The trapezius is named because it's trapezoid, at least from some angles and some parts. Deltoid because it's triangular shape. Okay, so those were all the head and neck muscles, but this is kind of telling you like some of the major ones and helping you get a big start on these head and neck muscles. But again, if you like the classifying system, this helps to tell you about general trends, especially like the opposite roles, because it's like, hey, if there is this term that has an opposite, there's probably a muscle with that same opposite term somewhere in the body. But there also are exceptions where it might not be in the human body, but it might be in like other animals that have these muscles as well, like other animals with a spine or vertebrates.